Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30 we have international session in English, and from 9:30 to 10:30 a local language session in Malayalam. And let me introduce the guest of the day, Professor B.D. Patel. Sir is a well-known figure in homeopathy all over India because of his knowledge in 16 languages, and he is a person who can deliver the homeopathy in the different subjects in India and all over the world. And he has been doing all these things throughout these years. And he was the former principal, Government Homeopathic Medical College Hospital, Bangalore and Chandigarh, and former director and dean, VM Homeo Medical College Hospital, Salem. And he runs 2 clinics in Jayanagar and Bangalore, and 2 sessions. And he has been teaching and medical practice for the last 51 years, and has been um, uh, into the corporate training, especially for youth, and doing lot of wonderful works for homeopathy. He is a public speaker in various forums on various subjects, a Rotarian since 1990, and held many portfolios served by Rotary with the Best President Award, AG. He is the director of many Avenue Outstanding District Collector, a District Director for Youth Member Rotary Club Junction. Trained many students in RYLA program, speaker and spiritual subject also, and recently received Aditya Ratna from NTR 100th birthday celebration committee, and received many awards in the name of few excellent service in homeopathy by Research Society of India, Dr. Hanuman Memorial National Award, Living Legend Award by Homeopathy Friends Gorakhpur, Excellence in Homeopathy by Homeopathic Science Congress Society, Uttarakhand, Lifetime Achievement Award, Dr. William Shavre, a doctor, and many more. He is a patron of Kannada Qualified Homeopathic Doctors Association, now dedicated the life for treating patients and study Vedas, Upanishad, and right interpretation of Upanishad in services of the entire humanity, giving discourses in many organizations, Temple, Rotary, colleagues, youth. And today, an entirely different subject. Nobody may not be talked about such a subject ever before. Nobody has done such a talk on the subject never before. That is sanitizer, side effect, and solution. So we proudly welcome the guest of the day, Professor Patel sir.
Thank you. Thank you, Dr. Daneshji, for introducing me. Anyhow, I have been always thinking that how we can add value to this wonderful organization, IFPH, which is doing a human service for so many years, uninterrupted. That's what I'm surprised. Uninterrupted. Every day, somebody speaks on some subject. Anyhow, sir, we'll straight away go to the topic. And today's our topic is sanitizer and its side effects. So, can I share my this thing PPT?
Yes, sir. Yes, sir.
Is it visible?
Yes, it's coming, sir. Yes, yes, it's visible now.
Yeah. Friends, sanitizer, side effects, and solutions. Okay. हम इससे पहले सदा हाथ धोना कभी भी ना भूलेंगे हो घरों या बाहर पानी हो ना हो घर में सिखाई अच्छी आदतें अब बाहर भी जाएंगी क्योंकि डेटॉल हैंड सैनिटाइजर करें घर वाले हैंड वॉश जैसा असर और 100 बीमारी फैलाने वाले जर्म से सुरक्षा तभी तो मां माने सिर्फ डेटॉल का खिला All of you might have seen this ad, and this has been very famous. Anyhow, sanitizer came more during the COVID-19 pandemic to prevent that or to be away from that. Preventing the spread of COVID-19 pandemic, a lot of health protocols were prescribed, especially the use of sanitizers and disinfectants was given more attention. How much it prevented, we don't know, but that has boosted the business of sanitizers skyrocketing. Somebody was telling me that all company has made so much of profit during this pandemic and after that, which they didn't do earlier. Now, hand sanitizer is a liquid. It comes in liquid form, gel form, or foam form, generally used to kill many viruses, bacteria, microorganisms on the hands. It can also come in the form of a cream, spray, or a wipe. According to sanitizers, their products kill more than 99.9% of germs, including bacteria, fungi, and viruses. Sanitizers also kill the bacteria that are useful for body. This is what I want to stress, that we have a lot of bacteria on the body, in the body, which are good and needed for the body. Even those things are killed by whatever things we use, sanitizers. According to CDC, Center for Disease Control Prevention, sanitizers can contribute to the development of antibiotic resistant bacteria. You can just see that. If you keep on using too much of sanitizer and other things, they can create antibiotic resistance bacteria. The key active ingredient in sanitizer is modified form of the antiseptic phenol called as chloroxylphenol, 4.8% concentration of weight to volume. Compounds such as glycerol may be added to prevent the drying of the skin because of the sanitizer. Some versions contain fragrance, which have the risk of allergic reactions. Some sanitizers, they smell very good, but they have more risk of allergic reaction in the body. Most frequently reported health issues include skin effects and respiratory effects due to the use of sodium hypochlorite and perchlorine in the sanitizers. Hand sanitizers can have risks to children's eyes, face, chest, and skin. Consumption under age 12 can lead to hypoglycemia, apnea, or acidosis. See, the sanitizers are so attractive and so colored. Sometimes they're very smell. Children tend to smell it. Children tend to sometimes swallow it. The CDC notes that children are particularly at risk of ingesting hand sanitizer, especially if it is scented, bright color, or attractively packaged. Excessive use can make your hands dry. Sanitizer should not be ingested at all. It can lead to corrosion of the entire mucosa in oral cavity, pharynx, larynx, and all parts of the digestive tract, and causing diarrhea, vomiting, and abdominal pain. Lung aspiration that can lead to the loss of pulmonary function and even cardiac arrest. It can be so bad. In March 2012, 6 California teenagers were hospitalized with alcohol poisoning from drinking hand sanitizer, making it the latest in a string of household products used to induce intoxication. You may be surprised how sanitizer can be intoxicating. Yes, because there is alcohol. And I've seen children smelling it, and they feel happy. The same thing earlier they used to do with the boot polish. The boot polish, they do it and then they smell it. It's an addict. It will be an addiction. Can cause blindness or damage vision if it gets into your eyes. Damage to nervous system, loss of conscious, and even death if it is ingested or goes into lungs. Ingesting and inhaling sanitizer every day can increase your risk for alcohol poisoning. A study published in the Journal of Occupational and Environmental Medicine, farm workers who used hand sanitizers had increased level of pesticides in their bodies. Imagine now, non-alcohol based version contain benzalkonium chloride, or it is called as triclosan, but they are less effective than alcohol based one. Triclosan might be hazardous to human health as studies of the compound are still going on. Now, hormonal impact. Triclosan contributes to making bacteria resistant to antibiotics, and the FDA says may lead to hormonal disruption. Male hormones and female hormones are disturbed by triclosan. If your hand sanitizer is scented, then it's likely loaded with a lot of toxic chemicals. 2011 study by the Epidemic Intelligence Service at the US Centers Disease Control and Prevention, researchers found that healthcare employees who were using hand sanitizers over soap and water for routine, they had more infections of norovirus, which is the basic reason for acute gastroenteritis. So imagine too much use of sanitizers can even lead to this infection. Alcohol, while effective as an antiseptic, can also dry out your skin. Frequent use of sanitizers can lead to dry, flaky skin, increased sensitivity, can pick up germs easily. If you have eczema, hand sanitizers can worsen your symptoms. After hand sanitizer dries on your hands, you may notice itchy, red, or discolored eczema patches. So be careful and observe them. This is all allergic to alcohol, and this is what it happens, and this is what is the picture. Under normal conditions, our body is covered with bacteria. Let us realize this as homeopaths. These bacteria are in harmony with our body, and our body has effective resistance to them. They live there, they breed there, they die there, and the cycle continues, and we remain protected from them in the safe way. Just imagine if there was no hand sanitizer, were we not living? We were living healthily, no problem. Now, how to use hand sanitizer? A little caution. A pump or two from hand sanitizer dispenser should be enough for your hands. Otherwise, some people really wash so much, everything like it comes out like a soap. Too much of hand sanitizer they use. One or two pump is sufficient. After use, wait until your hands are completely dry before touching your eyes or your face. Stick to external use only. Never ingest or taste hand sanitizer in any form. Apply a moisturizer after the hand sanitizer has dried up. Keep hand sanitizer in a cool, dry place to prevent alcohol evaporation. Now, solutions. Natural sanitizer, aloe vera, tea tree oil-based products encourage the use of biodegradable, non-toxic alternatives. There are many. You open up Google, you ask people, they will tell you. Do-it-yourself sanitizer, homemade recipes with the safe ingredients, which we were preparing, we are using before sanitizers came into the market. Soap and water emphasize that hand washing is often more effective and safer than overusing of sanitizers. Still, the old one is better than the new one. Now, the next point is tissue paper. We use tissue papers.
जब सॉफ्ट स्ट्रॉन्ग और अब्सॉर्बेंट टिश्यू का साथ हो फिर क्या फिक्र फिर बस टेक अ डैप
Now, tissue paper, understanding the environmental and health impacts. Tissue paper is widely used in the households and industries for hygiene purpose. Common types include toilet paper, facial tissues, paper towels, car tissues, kitchen tissues, and napkins. All these are different type of tissue papers available in the market. The increased demand for disposable paper products globally has increased so much. Economic Times of India says the demand is growing at 20 to 25% annually, and that too in India. Forget about the other world. Hotels, restaurants, caves are already equipped with a bundle of tissue papers, and this makes visitors feel that they practice healthy hygiene. This is the idea we have, that when we use a tissue paper, we are healthy. Absolutely no. And nowadays it has become so much. When we go to hotel, first thing we say, hey, bring tissue paper. Tissue paper, and then they take it 2, 3, 4, and then wash their hands and dry their hands with the tissue paper. Tissue papers are overtaking cloth napkins and kerchief, as the tissue paper is thrown away after its use, and they think will cut the spread of infection. We think that when we use the tissue paper and throw it away, we are safe from the infection. Absolutely no. Approximately 27,000 trees are harvested daily for toilet paper manufacturing, which adds up to around 15 million trees per year. This was 5 years back record. Today it is much more. Imagine 20,000 trees every manufactured daily are cut. It takes a lot of energy to make tissue products, as pulp is dried into sheets using machines that are like giant hair dryers. The process of cleaning and preparing pulp requires water, which is essentially wasted and harms the environment as well. In fact, 37 gallons of water are needed, almost 140 liters, to manufacture a single roll of toilet paper. Imagine now how much water we are wasting just to prepare a toilet paper. All of that water is essentially wasted, which further harms the environment. Chlorine is used to bleach the pulp and turn it white, while other chemicals are used to soften the pulp. This all leads to local water bodies being polluted. Today, the majority of the toilet paper is made from virgin pulp. Virgin pulp is more dangerous. The carbon footprint of the toilet paper made from virgin pulp is much higher than that of a toilet paper made from the recycled waste paper. The toilet paper manufacturing releases greenhouse gases into the atmosphere. Toilet paper is contributing to climate change very badly. While toilet paper is biodegradable, it will emit greenhouse gases. And these are the greenhouse gases. Carbon dioxide, see how much it gives. 80% almost carbon dioxide. Methane, nitrous oxide, fluorinated gases, hydrofluorinated gases, perfluorocarbon, sulfur hexafluoride, nitrogen. So many of gases are being emitted and thrown out into the atmosphere by the companies that manufacture the paper, tissue papers. Wet wipes, sometimes when you go for dinner and all that, they give wet wipes. You just take a cut it, open, take out, and clean your eye. Wet wipes are made from plastic. It is not even from tree, which makes them non-biodegradable. Wet wipes are also known to clog sewer systems because they don't dissolve and they always remain there. So they clog our sewer systems or our gutters and all that. According to the Statista report, global tissue paper consumption was approximately 37.6 million metric tons in 2021, and now it is 224. Imagine how much it is. The market for tissue paper in India is expected to grow significantly as more people adopt Western style of hygiene practice. See, they think anything Western is very good. This is what concept is there in our Indian minds. So because they know we are using tissue paper, though we are more safe because it has come from outside. Pre and polyfill Fluoroalkyl substances, PFASs are called as, are toxic. They have dangerous effects on the environment and our health, like altered immune and thyroid function, liver disease, lipid and insulin dysregulation, kidney disease, adverse reproductive and developmental outcomes, and cancer. These PFASs are found in a lot of products what we use. They are known as forever chemicals because they never break down, and even and when taken in remain present in the human body for a long time. Now just imagine, does the toilet paper dissolve anywhere? No, it will not dissolve. It will be there. Tissue products often come to us wrapped in plastic. See, whatever tissue paper, it is covered in the plastic. That plastic doesn't break down, and the use of single-use plastic in billions of everyday products is causing havoc in our ecosystem. Now, whatever we are seeing, so many floods, so much of rain, so much of unwanted heat and all that, all this is because our style has changed. Our living style has changed, and products we use emit a lot of things that are not good for the ecosystem. Deforestation. Tissue paper production requires cutting down trees, contributing to deforestation. Water and energy consumptions. High amounts of water and energy are used in the production and process. Waste generation. Tissue paper is often non-recyclable and adds to landfill waste. Chemical exposure. Tissue paper is often treated with chemicals like chlorine, which can leave residues in the body. Skin irritation. Many people have seen they have skin irritation after using the tissue paper. Some individuals may experience skin irritation or allergic reaction due to chemical residues. Air quality. The production process can release pollutants impacting the air quality.
Toilet paper is dyed white with chlorine and chlorine dioxide, which can cause any number of diseases. Numerous studies have also shown that recycled paper products, including toilet paper, contain the chemical bisphenol A, or BPA, which can be absorbed through your skin transdermally. BPA is estrogenic. It mimics the human hormone estrogen and plays a role in male and female infertility, early onset of puberty, breast and prostate tumors, and polycystic ovary syndrome. Just think of using toilet paper like taking an estrogen supplement every time you wipe. Put it into perspective, the famous Women's Health Initiative study in the early 1990s tested the effects of supplemental estrogen on women. But the study was forced to stop early because participants began developing cardiovascular disease, stroke, dementia, and cancer.
Now, tissue paper can cause fluorinated toilet paper contains the highest amount of furans out of all cosmetic tissues. Dioxin, a bleaching byproduct, is one of the most toxic human-made chemicals. Scented toilet paper. The chemicals in them can also disrupt the normal pH and lead to yeast infection. Those who use a lot of tissue paper, and then I should really remember, and you tell just now before this class, whatever we are talking about, 1 hour before, a lady came with an UTI problem, UTI infection. And then she said so many symptoms. Then I asked, do you use tissue, what it calls, sanitary naps or tissue paper? She said, yes, sir. I was using too much and I have stopped from last 2 years, but the infection doesn't go. So toilet papers and other things, they cause a lot of change in the pH value that can lead to yeast infection and other infections. Dioxin furans are highly toxic, can cause reproductive and developmental problems, liver problems, and elevated blood lipids. It can imagine now, where is that we are using externally, but they affect so much, it enters the internal organs also. Damage the immune system, interfere with the hormones, and also can cause cancer.
This is Dr. Rasya Dixit from Dr. Dixit Cosmetic Dermatology, Bangalore. skin wipes or wet wipes really good for your skin? Well, the answer has to be no. Though it is a very convenient model, you have to imagine that a wet medium, a wet tissue, is always a great place for a bacteria to grow. So your wet tissue not only contains some cleansing agent, but also contains a lot of preservatives as well as some antibacterial agents. And these might not be actually good news for your skin. It might actually make sensitive skin much worse. It can make normal skin sensitive, and it is not great for long-term use. The reason is that these products, they contain a lot of medicines like parabens, like antibacterial agents, and these on long-term contact with the skin can produce a lot of redness, sensitivity, and rashes. So though better on a regular regime not to use a wet wipe to substitute for a face cleanser. So your soap and cleanser for your body and your hands, and definitely a soap-free face wash for your face is the best option to keep your skin in its best health.
White toilet paper often contains bleach, which can be very irritating to vagina and other soft tissue. See, we generally Indians are supposed to wash with water. Now, because of Western influence, and we think that anything comes from outside is good. So people are using tissue paper even for cleaning themselves in the morning when they go for toilet. And some ladies use tissue paper, which causes vaginal infections. These chemicals react with organic molecules in the wood and other fibers to create many toxic products, including dioxin. Reusable cloths. Using washable cloths as an alternative to disposable tissue paper. This is the best way. Use a cloth which can be washed again. Budgets. Using water-based cleaning methods like budgets to reduce toilet paper use. Good. Eco-friendly brands. Choosing tissue paper made from recycled materials or bamboo can be a little preferred over the other one. Safety for children. Tissue paper should not be given to children below the age of 3. Young children may have a habit of eating, chewing, or swallowing tissue paper, which can be very dangerous. It may be fatal if they swallow more number of papers. It's a common habit for children to put everything in the mouth. So they may not understand, and this may happen. So be careful as far as children are concerned. Consider reducing tissue paper usage and exploring more sustainable alternatives, that is, handkerchief. The best substitute for tissue, non-infectious, reusable, washable, economical, saving trees. Above all, is handkerchief. You wash, you clean anything, take home, put it in the washing machine, wash it, again reuse it. Actually, we were using only these things earlier. Even in the hotels, when you go, they used to give us a towel, which but now they're starting giving tissue paper, which is bad.
हर जगह एक ही सवाल, भारत के नंबर 1 हार्पिक से बेटर कौन है?
हार्पिक से बेटर कोई निकला तो संन्यास ले लूंगा। तो अब आप ही बताइए साइंटिस्ट साहब।
सॉरी अक्षय, ये हार्पिक से बेटर है।
संन्यास।
कोई जरूरत नहीं अक्षय, क्योंकि हार्पिक से बेटर नया बेस्ट एवर हार्पिक ही है।
इसका नया फॉर्मूला दे 10 गुना बेहतर सफाई सिर्फ 5 मिनट में, और अब खुशबू से भी महका है। अब खुशबू वाला नया बेस्ट एवर हार्पिक नहीं ट्राई किया?
Now, when such ads come, anybody is influenced. These are the toiletries and their effects, we'll see. Understanding personal care products and their impact. Designed to remove hard water stains and calcium buildup often found on faucets, shower heads, and glasses. Formulated to remove soap scum and water spots from showers and tubs. Specifically formulated to clean and disinfect toilets, targeting stains and bacteria. Soap and body wash cleans the skin by removing dirt, oil, and bacteria. Shampoo and conditioner cleans and moisturize hair, removing oils and dirt. Toothpaste, clean teeth, prevent cavities, and freshen the breath. Deodorant and antiperspirant control body odor and reduce the sweat. Now, let us see, friends, don't we use all these things? But there is a limit. People overdo it, and then they come with the problems. Shampoo and conditioner should not be used for more than once in a week. People use it, some girls, some ladies use it every day. Some people use weekly, thrice. Only thing is hair looks oily or chip-chipa. That's why we use it. Whatever it is, do not use some, because shampoos and conditioners are chemicals. They have all those side effects. Now, toothpaste. Now, let me tell you, just let us go 50 years back. Many of the people are there. We were using neem tree's twig to clean our teeth. And one of my dentist friends, I asked them, tell me which is the best thing for cleaning the teeth. He says, sir, even till today, neem twig. You take a neem twig and then clean it. Even it goes inside, it will remove all the unwanted things in the body. That is the best. But today, hardly anybody uses, and everybody uses different paste and this thing. And they have to paste, full paste. They brush, they put full paste. And you see the amount of things it harms. And then deodorant, the way that it is advertised by the film actors, the moment you are going for a party, use a deodorant to reduce your sweat or whatever it is. When odor comes from the body, it is something wrong in your body, and we have a lot of remedies to remove the deodorant. Breath is also there is a smell. We have medicines which can remove the bad breath from the mouth, change their eating habits, change their living habits. The things can be set right. So deodorants are pure chemicals today, what we are using. Whatever is advertised, they are pure chemicals. Earlier time, people were using preparations prepared from fruits, leaves, flowers, etc. They were medically good, and as a smell also it was good. But today, some people are so allergic. I remember some 15, 20 years back in my clinic, a patient who was cured with asthma completely. 90% their lady was better. I told them, stop the medicine, and with this course, you can, and whenever it comes, you can come back. Within 5 minutes, she came with a severe attack. I said, what happened till now? Yeah, but sir, nothing, everything is fine. But one other lady came with some deodorant using the body, and that precipitated the attack. Remember, friends, from that time onwards, I'm trying to do some work on this, and this is how the result is. They are pure chemicals. Lotion and moisturize, hydrate, and soften the skin. Now, these are some of the products which are used. Now, cosmetic and personal care products, what they have. Metals are part of cosmetic formulations and can get absorbed through the skin, accumulate inside the body, and cause harm to internal organs. Coal tar hair dyes used in hair colorants can cause allergic reactions, hair loss, and injuries to the eyes. A study published this year showed evidence of high concentrations of fluorine in makeup products such as foundations, mascaras, and lip products. Potentially toxic chemicals called PFAS, earlier described, are present in the products. Butylated hydroxynosole, BHA, or butylated hydroxytoluene, BHT. These both chemical compounds are used as antioxidants and preservatives in cosmetic preparations. However, there is a lack of clear labeling for certain ingredients, such as PFAS, found in makeup products. They don't mention it properly, but the danger is there. Formaldehyde-releasing preservatives are used to prevent the formation of bacteria. Recent research detected high concentrations of fluorine in makeup products. PFAs are associated with various health risks, but their safety profile varies due to diverse chemistries. Parabens, as that lady was telling, parabens used as preservatives linked to hormone disruption. See, whenever we are treating, we should all, as a doctor, should even ask what are the toiletries you are using, what are the cosmetic products you're using. That may be a block in our treatment, obstacle to cure. So you need to remove that also. Phthalates found in fragrances associated with reproductive issues. Wherever any product that gives a very good fragrance, it can affect your hormonal levels, hormones of the body. So whether it is sanitizer, whether it is tissue paper, whether it is sanitary pads or anything else. Sodium lauryl sulfate found in soaps and shampoos can cause skin irritation. Triclosan, antibacterial agent linked to antibiotic resistance and hormone disruption. Now, chemicals from toiletries contaminate water sources. This we can easily understand. Microplastics found in exfoliating products, they contribute to ocean pollution and harm marine life. Waste, excessive packaging and non-biodegradable materials contribute to environmental degradation. Now, next comes the diapers, which the children use. It may lead to toxicity. Diapers are made with chemicals and synthetic materials. Just imagine, diapers for longer duration at night is not safe, especially with children. The harsh chemicals may be entering your baby's system leading to toxicity, because the child's skin is very sensitive, and especially the anus, especially the vagina or urinary this thing, they are very sensitive. So they easily take up the chemicals into the body. More chances of infection. Diapers are made with a material that allows absorption of your baby's urine. The same substance hinder the easy flow of air inside your baby's diaper and creates an apt condition for bacteria and other germs to breed. Now see, this is what it is. You have seen in the advertisement also. Mostly they use silicone products or I don't know what. It absorbs 1 liter of water. How can that be safe for your child? It may not come out and this thing, but the staying of that water, wet pad or those things on the body itself has a chemical effect. Earlier times, we were using only cloth-made diapers, which the mother used to change or wash it and bring it back. The child was healthy. Today, there are a lot of problems with the children who are using diapers. It may cause allergic reaction. Some diaper manufacturing companies often use synthetic fibers, dyes, or other harsh chemicals. All these harsh chemicals can cause allergies. It may cause skin rashes, which is called as a diaper rash. Very common in babies. If a wet diaper is left on a baby for longer than usual, bacteria may breed in the wet soiled diaper and may lead to rashes. See, your diaper itself may encourage the bacterial growth. Difficulty. Now, this is some of the parents have come and complained. Babies get used to peeing and pooping in the diaper, and parents find it difficult, they find it convenient too. They're also happy. But the problem is, however, when you try to potty train your baby may whimper and fuss. Toilet training lessons that usually start early in life, they may not pass stools when you try to make them sit in the toilet and do that, because they're used to pass the motion and urine in the what you call pads, sanitary napkin pads. So that will be the, and then the child will have difficulty in future. Diapers are not environment friendly. Large number of diapers get disposed in the environment containing plastic, synthetic fibers, and other chemicals. All these are difficult to decompose and pose a threat to the environment. It may suppress immunity. Diapers may cause urinary or fungal infection, and the more their immunity is suppressed, making them susceptible to further infections. Add to that volatile organic compounds present in the diapers, which further affect the immune system. Can believe it? Can we believe? The more and more we are trying to adopt the easy methods that come from the Western world, more and more diseases and problems are coming up. Apart from the money what we spend on these products, we are inviting more diseases. Diapers with a hard elastic band may press down on the baby's waist and leave imprints that feel itchy. If you find red marks around your baby's waist or thighs, or you find your baby crying more than usual, immediately remove the pad.
बीते 2 दशकों में डायपर्स का इस्तेमाल तेजी से बढ़ा है। खाद्य
आजकल हम लोग इची सॉल्यूशंस देख रहे हैं विदाउट रियलाइजिंग इट कैन बी हार्मफुल टू द बेबीज। आजकल जो डायपर्स हैं उसमें भी काफी क्वालिटीज आ गई हैं। मोर इट रिमेन्स ड्राई, पेरेंट्स थिंक इट इज गुड और दे मे नॉट चेंज सो फ्रीक्वेंटली, राइट? बिकॉज आइडियली एवरी टाइम बेबी पासेस यूरिन उसका डायपर चेंज होना चाहिए। You are actually, giving pressure to the abdomen. से जो किडनीज का 2-3 फैक्टर्स हैं इसके मेनली। वन इज किडनी के ऊपर प्रेशर आता है, उसका ऑक्सीजनेशन कम हो जाता है किडनीज का खास तौर से। दूसरा है बेबी का फ्लो नहीं होता, यूरिन स्ट्रीम इज पुअर।
को कपड़े की लंगोट पहनाई जाती थी जो टाइट नहीं होती थी। साथ ही महिलाएं थोड़ी थोड़ी देर में बच्चों को उठाकर पेशाब भी करवाती थी ताकि वो लंगोट या बिस्तर गीला ना करे।
देखो पता चलता था कि उसने व्हाटएवर यूरिन पॉटी कर ली है, इमीडिएटली वी चेंज।
पुराने जमाने में बच्चों को जो लंगोट पहनाई जाती थी वो सूती या मुलायम कपड़े की बनी होती थी, लेकिन डिस्पोजेबल डायपर बनाने में सेल्यूलोज, पॉलीप्रोपाइलीन, पॉलीथीन और माइक्रोफाइबर्स का इस्तेमाल किया जाता है, जिनके ज्यादा इस्तेमाल से डायपर रैश, स्किन डिजीज, एस्थमा और लिवर डैमेज जैसी बीमारियां हो सकती हैं। अमेरिका के पीडियाट्रिक बच्चों को लगातार कई
Imagine the diaper can cause even liver damage, and the doctor who was speaking is from All India Institute of Medical Sciences, Delhi, and there are a lot of videos which tell you that don't use diapers for the children. Now another one is sanitary pads. Side effects of sanitary pads. Majority of sanitary pads are bleached and to look white and clean, which could produce lots of dioxin. This can affect reproductive organs. Please, we are all treating a lot of cases where there's a problem with having children. So this can be one of the reasons. Please think. Let us think. Majority of pads are burnt, releasing dioxin and furans into air. Volatile organic compounds are used in perfumes, softeners, absorbents, adhesives, and binders in menstruation products. All these are added to sanitary pads for the feeling of freshness. Imagine so many things are added to make the pad very fresh and the lady will feel very comfortable. You will feel comfortable for some time, but imagine what is happening to your body. It can also damage liver, kidney, and respiratory organs along with reproductive organs. You'll be shocked by using sanitary pad, how it affects the respiratory organs, how it affects the liver and kidney. Some of the plastic material have the potential to emit toxins like phthalates and VOC, which are absorbed via the delicate vaginal mucosa and skin. Vagina, as I earlier told you, vagina is very delicate. It can absorb easily any chemicals and those things. See, imagine when you put pads like with all the what advertisements they do, there is no airflow. There should be airflow, free airflow, because this will change the pH. This is one of the reasons for a lot of urinary tract infections. So imagine if there is no airflow, whether it is for child or it is for lady, it can create problems. These products are absorbed 18 to 20 times more through vagina than oral mucosa. It can affect hormones and cause infertility, can increase the breast and cervical cancer. What it can do? Rashes, vaginal allergies, inflammation of pelvic organs, ailments related to endometrium, hormonal dysfunction, infertility. Imagine it can go to the extent of infertility, damaged immune system, malfunctioning of thyroid, and cancer of ovaries. Now, the next product what we're talking is, everybody is very happy with this. It is smart watches. Negatively affect memory and mood. The release of excess EMF waves often leads to nausea and headaches. Also concern for potential cancer risk. Imagine smart watches like smartphones. The median nerve can be compressed by the band of the smartwatch. Constantly checking your watch can lead to wrist strain. Wearing a smartwatch can cause skin irritation, especially if you have a sensitive skin. Heart rate monitoring error. This is very important for us to see. Inaccurate heart rate monitoring can lead to unnecessary anxiety or medical intervention. This don't believe on smartwatch 100%. Sometimes it can give a misleading reading also. So immediately you'll see that and immediately go to a doctor. He may say something else and it can lead to a lot of unwanted things. Medical implant interference. Smartwatches may interfere with the pacemakers or other medicinal implants. Overemphasis on health metrics such as heart rate, steps, calories burned can lead to unhealthy behavior such as compulsive checking starts or exercising excessively and create anxiety and addiction. Now just imagine, friends, it gives some reading and that reading we take it as a final and we start changing our lifestyle as per the smartwatch. How many steps I walked? 100 steps. I should walk 10,000 steps. Is that this thing? It is only a suggestive one, not the final one. Don't ever believe so much on these smartwatches. I've seen many people, they check up, oh, I have to do 100 steps more. They do. It is not necessary. It creates an anxiety in the patient and then it becomes addiction. Every time check, how much is my heart rate? How much is my this thing, respiratory rate? Keep on down checking that. Every time. See, human being changes. A lot of factors are there which change. While sleep trackers are useful, they aren't always 100% accurate. Use the data as a guideline only. Activate night mode to reduce blue light emission, helping to protect your sleep cycle. Avoid frequent checking before bed, an hour before bed to improve your sleep quality. Wear your smartwatch intermittently. Fitness tracking can cause an unhealthy competition. Just have a look at this. See how much toothpaste he's putting, how much he's conscious. See, he's drying his toothbrush. How much Dettol he has used there? Half the bottle. He's blowing the bread. You see the fellow, how sensitive he is. And
Hi, baby. How are you? Hey, Anand. How are you, man? Anand, any problem? Fever? Touch photo. నాచేకండి బంగారం గోల్డ్ డూడ్ కమ్ ఆన్ వాటర్ లేదు టిష్యూ లేదు సోప్ లేదు చెయ్యి ఎక్కడ కడుక్కున్నారా ఎదవా అవసరం ఏముంది అవసరం ఏముంది అంటున్నా ఈ చేయిందా ఈ చేయిందా అబ్బాయిలో నాకు కొంచెం రఫ్ గా ఉండాలా ఒకసారి నన్ను హక్ చేసుకో యూ ఫీల్ బెటర్
Just this man was about to sneeze.
ఏంటండి డెఫినెట్లీ క్యూట్ అనగా తెలిసి ఇది చూసినప్పుడు వెనక్కి హ్యాపీ బర్త్డే హ్యాపీ
You see,
చుక్కలు రాసుకొని ఓపెన్ చేస్తా
you see, the hero is presenting to his girlfriend all toiletries. This is what happens if you are hypersensitive for cleanliness. Hyper cleanliness can lead to OCD. So let us be normal, let us be clean with clean products and Indian way of cleaning.
जी मैं डॉक्टर सिन्हा अमेज़न से आया हूँ। अमेज़न से डॉक्टर कहिए आपकी वाइफ का चेकअप करना है। मेरी वाइफ का चेकअप क्यों क्या हुआ इसे? लगता है उनकी तबीयत खराब है। आपको किसने कहा ऐसा? उन्होंने 3 दिन से अमेज़न से कुछ भी ऑर्डर नहीं किया।
You understand this? Amazon, see, that lady has not purchased anything from Amazon for 3 days. So they are sending a doctor. Every day people are used to purchase something from Amazon. This is what is obsessiveness happening because of we trying to adopt Western culture, Western way of living. No, this is India. Following Western trends blindly without understanding their principles and values. They think it adds to their status, which does not add. Your health adds to your status. Your well-being adds to your status. Your personality adds to status, not the Western culture. See, modernization doesn't mean Westernization. All of them are working, writing exam, everything, but they need not change themselves. Everything in East India is superstition, and everything that comes from West is science. This is what our mindset is for the last 75 years after independence. This is what ingrained in us. All the companies are Western, and they promote, they it is very attractive. You know, see all the products, whatever they are there, none of them is an Indian company. They're all Western companies, and they know how to market, how to influence the Indian public, because India is a very big market for them. So other lectures are there. If you want, anybody can organize, arrange that. All that. Thank you, friends. Thank you very much. If any questions are there, you can ask us. We have 3 minutes to go.
Yes, sir. It's really a wonderful session indeed. It is the first time that a homeopath come out with such a big subject and one positive subject. This kind of presentations are the need of the, because people are under threat that they believe that unless using all these things, you will be in danger. So you have to use all these things. This is what is called the big business lobby, and the WHO is working for them also. That is the reason why they always say that this is the thing that protects you rather than your health. Your primary, every man has his own protective mechanism in himself. But unfortunately, people believe that something extra caution is needed to protect themselves. Am I right, sir?
Yeah, we want the doctors to tell their patient, educate their patients, use it minimum. And if you think before using it is necessary, just think before these products came, were we not healthy? You just take 2 generations before. Each family was so healthy without all these products. With these products, we are more having problems and diseases.
Yes,
Sit down, Danesh.
definitely we need this kind of presentation in as per your convenience later, sir. So,
Any questions are there? You can take. We have 2 minutes.
yes, yes. Very. If Dr. Hibbert,
Sir, a nice presentation, and you are always, you can know how to tackle the people around you. So it was a very nice presentation. So we must think all the time. We are thinking that all these things are needed for us,
Yes.
but we need only less, very less. That will make our life very beautiful. Otherwise, our life will be.
I'm so happy with the Kerala people. They use coconut oil so much, hardly they get any skin disease. And their hair are long, without any makeup, without any products, and they're very strong. And my patients are there. They fall very less sick, except some other problems. They use original Kerala food. They eat that, and that keeps them healthy. So this is what I want people to promote. So you can tell your patients also. Yes, sir.
Somebody
yes,
asking,
yes,
Dr. Paul Joseph from
yes,
Canada.
Okay.
yes, Paul Joseph, you can
Yes,
please,
sir.
please unmute yourself. Please, please unmute.
Okay.
Hello, sir.
Yeah. Yes, Paul
Yeah, this
Joseph
is,
ji. Yeah.
yeah. Good morning, sir. Good morning, sir. How are you?
I'm fine. I'm fine. Top of the world.
Yeah. So really, it's a very
Paul ji, you're
big,
settled in Canada.
yeah, I'm settled in Canada.
Aye,
Almost I'm here in for more than 15 years.
Okay, okay, okay.
Yeah.
I
So
hope you are safe there.
the thing and what you explain is really it's a need of the hour. The subject is the need of the hour. So very interesting. And often you mention about the dioxin. So that's
Yeah.
why I wanted to highlight that point, the dioxin. The dioxin that the chemical they are using in the laboratory
Yes.
animals to induce the diabetic. To induce the diabetic. See?
Imagine now.
Yeah, yeah. Now you can imagine why the diabetic range is higher, now higher and higher. So that's why I wanted to highlight, and I was just, thank you, sir. Thank you for your kindness.
Thanks.
Yes, Dr. Paul Joseph, you can say vote of thanks to the session also.
No, I'm with the patient. I'm with the patient.
Okay. And so I invite Dr. Hibbert to say vote of thanks.
You are always a man of happiness. In the whatever you are saying will give us energy, energizing us. So you are all the presentations you are dealing with the different types of presentations each and every time. That makes us more. In addition to that, I saw you have a personal make up with the other people, the conversation method, and it should be all the people should. You are a person who can make a model for us. In different languages, you know how to tackle the languages, each and every languages you can follow. So we are very happy to see you all the time. Thank you very much, sir. You are always welcome to our platform. It was a graceful thing for us. Thank you, sir.
Shubharatri.
Thank you, Dr. Hibbert, and thank you, Dr.
Good night to everyone.
And all those who attend the session. Tomorrow we will have a session from Dr. Paul Joseph from Canada, and we'll be talking about organ clock and homeopathy and unrevealed secrets. That is what is the subject of discussion. That will be a thrilling one. Hope everybody can enjoy the beauty of Dr. Paul Joseph presentation also. With that, we come to the end of the day, 1552, and it is over to Dr. Hibbert to moderate the Malayalam session. Thank you all. Right.